What he did know, however, was that CBD and THC oil did work effectively with radiotherapy. I was highly agitated and I didn't know what to do.
Total cure.
On the 13th of January, the day I was due to begin radiotherapy, I called the hospital and told them that I would not be coming in for treatment. I had decided against it. After all their preparatory work, needless to say, they were not amused and ordered me in anyway. I said no. I told my sister Catherine, who had been the care manager of a cancer hospice looking after patients in palliative care. I told my wife and family. I was prepared for a strong reaction. Lindsay, my eldest daughter, went ballistic over the phone.
Dad, you cannot do this to yourself or to us. You've got to face it.
So be it, I thought. We've all got to tough this one out. Then Catherine phoned and said she respected my decision but thought I should exactly know why I had been put on this course of treatment. She explained that my specialists had designed a plan for me back in July 2015 following the results of my biopsy. She said that I could do what I wanted, but they had not just shoved radiotherapy in as an afterthought. It was part of a strategy known as total cure, a course of treatment decided upon when a patient was not sick but fit and healthy enough to handle one treatment after another without the risk of overstressing his or her immune system or having a heart attack through shock. I was to be given radiotherapy to blast an area of tissue of any microcancer cells that might otherwise gestate a new cancer in my body several years down the line. That is why it is called total cure. This explanation made perfect sense to me, and it was Catherine that convinced me to go back on the programme. I went back the next day, apologised to the nurses and to my specialist, and began my 35 sessions a day late. As well as writing to my cannabis doctor, I'd also written to Charo, and later the same day, after my conversation with Catherine, I received this reply, written in very good English.
Dear Iain, today, after work, I had a long talk at the radiotherapy department, RTD, of my hospital with Dr. Jesus Oliveira. He is in charge of prostate cancer. He knows very well Dr. Paco Valcárcel and said he is one of the best in the field. He also knows Dr. Joaquin Velasco, another physician at the RTD of your hospital. Some interesting points. At the Puerta de Hierro hospital, they have even better therapeutic tools than at my hospital, with the last generation already bought. He totally agreed with the therapeutic schedule you're on. First, the hormone therapy, as you're doing. He does not start patients on radiotherapy until at least 3 months after surgery. Even, he said, you could have been told to wait 1 more month, depending on your symptoms in January, but you were healthy enough to begin. I found all this very reassuring, so keep going with the hormone treatment and the rehab. Love, Charo.
So now I knew what I needed to know. It amazes me that neither my urologist nor my radiotherapist had considered it important to explain the things that Catherine and Charo had clarified for me. It is fair to say that, yes, they had described the treatment and possible effects as required on the consent form I had to sign. Here it says that by signing the form, I accept that I have been given sufficient information for me to agree with the procedure as established by law, which was true. It then goes on to say,
this treatment is to be applied as a consequence of diagnostic studies, including a biopsy to treat prostate cancer. Understand that the treatment has been decided upon by the whole team and will be planned, realized and monitored by its members, and that simultaneously other doctors, nurses, physicists, technicians, auxiliaries may intervene.
I had pissed off a lot of people. I asked Dr. Valcárcel afterwards why I had not been told that I was on a program known as Total Cure. In his reply, he still thought that the less I as a patient knew, the better. For me, this was definitely not the case. My sessions were about to start, and for sure, during and following radiotherapy, there would be side effects, and some of them would be long-lasting. But my doctor and his team's job was to concern themselves with giving me the best treatment to ensure my cancer would not return. My job was to concentrate on attending each radiotherapy session with my bowels empty and my bladder full. A clinical viewpoint, but truth be told, they were all on my side.
To keep listening to this audiobook, I've left you a link in the description so you can do it. at no cost thanks to Audible's 30-day free trial.